Good afternoon, everyone. Welcome to another episode of Sunday Housecall. We have the pleasure and honor of having Dr. Nicole Sapphire with us, who is a very active doctor from Memorial Sloan Kettering, the Monmouth Center in New Jersey, and it's a pleasure to have you, Nicole, with us. We have tremendous number of medical topics that are important for the public, so this is an important way to give back to the community. So many people have been asking us, where is the medical show? They want to learn from us.
Absolutely.
So I'm glad to share this whole show with you. Obviously, one of the latest news that came out this week, and there's a huge buzz about this, is the fact that CDC announced that there's obesity, the relationship between obesity and cancer. And about 40% of these cancers are associated with obesity. And this is the first time that it's coming out in a big highlight. What is your thought about this particular study? And we're going to put out the list of all the cancers that are out there. And specifically, there are 13 cancers that CDC is calling that's related to obesity in America. Your thoughts on this?
Well, first of all, Dr. Samadi, thank you for having me and everyone for joining us today. This is a great study and something that I know a lot of people feel passionate about. It's a very well done study. So, you have some studies that come out and you're like, well, I don't know if I would believe that, but this is a great study put out by the CDC and the National Cancer Institute. They looked at all cancers in 2014, and then they also looked at trends from 2005 to 2014, and what they saw in those 13 cancers are about 40% of the people who got cancers, they were due to being overweight or obese. And that's very concerning, especially with the obesity epidemic, if you may, that we're seeing here in the United States. And it's really shocking to tell us we need to make some changes.
It's very interesting, Nicole, when you talk about the obesity epidemic in America. We've talked about this in the past on many programs, but I don't know if people really understand the scope of what's going on in this country. We talk about policies, we talk about guidelines, we talk about screening, but I think we're really concentrating on one end of this disease, but we're not going to the root of the actual problem. As you know, about 2/3 of Americans are suffering from being overweight and being obese.
Yes.
That statistics alone is a huge problem. $147 billion goes into obesity and other diseases related to obesity. So, no question. Tell me a little bit about what you see in your practice, the patients that are coming in, the patients you interact with. And I know childhood obesity and the example of what we're doing, putting out there for our children is also a big issue.
Sure. So I do breast cancer. That's my specialty. And I see a multitude of women and some men. And I will tell you, there's a large percentage some people are overweight or obese. And that's essentially, if you have a BMI from 25 to 29, you're considered overweight. And then over 30 is obese. And, unfortunately, postmenopausal breast cancer is one of those that are shown to be an increased risk if you are overweight and obese. And you said it yourself, it starts out in the home. You have a lot of teenagers, adolescents these days. I believe it's about 15% of all adolescents are already obese. That's just going to get worse as they get older, because if you are obese as a child, you're significantly likely to be obese as an adult. And it's not just about being overweight. It is everything that comes with being overweight. Being overweight itself, those fat cells are very active cells. They produce hormones, they produce proteins and inflammation. So from that, what happens is disease sets in. Cancers, cardiovascular disease, hormonal disease, it's a problem.
Well, I knew that you were going to talk about this, so we actually made a video which we will play in a minute. But what I want to do is I want to put up the picture of the list of all the cancers that are related to obesity for public to really see how obesity is associated. Let me just say, it doesn't mean that it causes cancer. This particular study didn't show, and it was published in Vital Signs, didn't show that it can cause, but it's associated. So the list is actually quite, you're talking about meningioma, multiple myeloma, which is a blood cancer, esophageal, thyroid, your field of breast cancer, gallbladder, liver, pancreas, kidney, ovaries, uterus, and more importantly, colorectal cancer. And the cancers that are associated with extra pounds in young patients are colorectal, pancreas, liver, esophageal, and gallbladder. So you can see that the whole array of cancers just from being overweight. And so we want people to really know about this.
Absolutely.
Interestingly enough, there was no prostate cancer there, which is good. But there was also a little difference between the racial difference in obesity. And I think non-Hispanic
It's
Go ahead.
largely, it largely has to do with where you live, your socioeconomic factors. And it's really important to say that you can have more non-Hispanic African American women are more obese, say in the South as opposed to the Northeast, but they have a higher incidence of cancer in the South as well, and perhaps that has to do with access to care, quality of care. So those in the Northeast, although they may be overweight or obese, their incidence of cancer and dying from cancer is actually less than it is in the South, and that really has to do a lot with socioeconomic factors.
The other thing that I want to put out there for people to know is exactly what are we talking about? What is the definition of obesity? So you and I at work, we talk about body mass index.
Yes.
Nobody out there is going to understand what we're talking about. What is body mass index? We look at the height, we look at the weight, we look at the body fat portion. There's a formula, and we come up with that body mass index you talked about. And as Nicole mentioned, body mass index of 25 to 30 is overweight, and over 30 is obese. One of the easy formulas that I always find very helpful for people out there to know, maybe we can put it up there, is you can actually test yourself now. And if you're watching this program, go out there and test yourself. You can actually take your height in inches, divide it by 2. And for women, this has to be less than 35 inches. And for men, this should be less than 40 inches. So that's very easy for you to know whether you are really in the range of obese. It's a very crude way of knowing where you are.
So that's a great diagram. So look at that. You can see the apple and pear. And so what does that mean? That's very different on how you carry your weight. And the apple is like the spare tire when people talk about having a spare tire. And essentially what that means is, your fat cells are mainly in your waist, as opposed to the pear-shaped body is the buttocks, the hips, and the thighs. Now, unfortunately, apple tends to be associated more with your cardiovascular disease risk, as well as the cancer, and not necessarily the pear. The pear body type, although unsightly and many women don't like it because of their pants, it's actually not necessarily directly associated with health effects.
So when we come back, I want to talk a little bit about visceral fat, which is exactly what you were talking about. Mm-hmm. The difference between apple shape, where you have a lot of belly fat. Mm-hmm. We've spoken in the past that belly fat in men especially is quite hazardous because of some of the enzymes converts testosterone to estrogens, the fact that they would lose their libido, the fact that they would get man boobs, and all these other stuff. And the best way to really take care of that is to lose weight. But as you mentioned, I think like some of the fat around the hip, and that actually is protective and cardiac protective.
Yes.
So let's take a minute break, and when we come back, I want to talk about the mechanism and what exactly obesity does to your overall health.
Okay.
We'll be right back. Are you getting up in the middle of the night many times to urinate? Are you suffering from sexual dysfunction? Do you know what your PSA level is? Have you been diagnosed with prostate cancer? If you have answered yes to any of these questions, please come and see me at our Men's Health Center in the heart of Manhattan. My name is Dr. David Samadi. I have committed my entire life to not only save you, but most importantly, to save your quality of life.
Trust your health in the hands of prostate cancer treatment and robotic surgery expert, Dr. David Samadi. Because having cancer doesn't mean you have to suffer.
It doesn't have a video. Welcome back. Another episode of Sunday Housecall. We have a pleasure of having Dr. Sapphire with us, and who is really breaking down all the myths and the truth about obesity. And we're talking about the recent study that came out of CDC, the relationship between obesity and cancer. Tell me a little bit about, what you think the mechanism of this cancer is. How does obesity relate to cancer? We know obesity causes diabetes. We know it causes heart disease. What is your thought about cancer and obesity?
So you have fat cells, our entire body. I don't have to tell you, you know this. Your entire body is made up of cells, and fat cells are particularly active. So not only are they producing hormones and proteins that are now going into your system, but they also incite inflammation. And cancer in many instances is caused by chronic inflammation. So if you have a large area of fat cells being constantly inflamed, it's a breeding ground potentially for cancers. And your entire body is in a state of inflammation, which we all know that's not good. We don't want to do that. We're trying to decrease the inflammation.
So interestingly enough, I think that's very accurate, because there are a lot of studies that shows also that when you start losing weight, the inflammatory cells in your bloodstream actually goes down. So the reverse is also correct. I think in your field of breast cancer and endometrial cancer, the changes in the estrogen level is really important. So I didn't know how far you were going to go with this. So I made a little video for us to be able to see exactly what obesity does. Roll the tape and let's see. This is how obesity affects your entire system. So today I want to talk to you about the effect of visceral fat, or what we call belly fat, which is really important. And this is like why Americans are in a lot of trouble. What belly fat usually does, it actually acts as a hormone, and it changes your hormonal balance in your body. It can increase your IL-6, and it can also increase your leptin, which is really going to throw you out of cycle. What's important in the liver, actually, the role of it is very critical, because what we've seen is that it changes your cholesterol level. And guess what? As a result, your bad cholesterol is going to go up, your good cholesterol is going to go down, and that's really detrimental to your health. The most important thing you need to know is what it does to your muscle, because muscle is responsible for your insulin balance. And by making your insulin resistance, now all of a sudden the risk of diabetes goes up. Your insulin is not going to function really well, and that's so important. In my field of urology, we've seen the effect of visceral fat on kidney, where it really increases the number of like aldosterone, and your sodium will go up. And as a result, we see hypertension or high blood pressure, which is really critical. Now, what happens when you have increased your cholesterol, diabetes is up, high blood pressure is up, something we call metabolic syndrome, which is a big term for really increase in stroke and heart disease. And this is exactly how belly fat affects your whole life. You want to cure cancer, you want to make sure that you cure any kind of heart disease and stroke. This is the page we need to concentrate. This is the page that Congress and everybody in America need to really pay attention, because two-thirds of Americans, two-thirds of America is really suffering from this, and this is what we need to be concerned about. Thank you. By the way, Nicole, it actually took me about 3 hours to summarize and really dig out all the information for the audience, and you can see that obesity is truly a systemic disease.
Very complex.
And we saw, as you mentioned, about the hormones and the IL-6, insulin growth factor that can cause cancer, cholesterol, increase your LDL, bad cholesterol, etc., and heart disease. So your comment about like the whole metabolic syndrome and how this obesity is killing Americans.
Well, that was an amazing diagram of metabolic syndrome. And it's not just about being overweight. As I mentioned before, it is a whole complex system that affects the entire body, from your brain to your kidneys to your muscle to everything, and can result in, as we've said, high cholesterol, diabetes, cancer, amongst other things. And so it's a problem. We need to make America healthy.
Well, make America healthy again. That's one of the names for the show. So it's funny because we talk about all of this, but also maybe another segment we'll talk about the fact that the whole bone structure is not meant to really carry the risk of arthritis and back pain and etc. So with the amount of time that we're sitting and we become sedentary and our lifestyle, this is all a huge problem. So, and we talk a little bit about the immune system that's affected by obesity as well. Now, okay, so we know that it may be associated with cancer. We also know that it's not good for us. How do we fix this problem? For someone who is out there and who's going to be listening, these guys only talk to me about the problems, but they're not helping me with the solution. And I think these guys, they don't want to hear pick up your fruits and vegetables, and they don't want to hear like go out there and exercise an hour a day. What's the fundamental changes or your message to the public if they're watching you? What should we do to lose weight? Because people think about North Korea as our enemy. They think about ISIS as people that... This is killing Americans.
Absolutely.
If two-thirds of America is overweight and 40% of cancer is related to this, the terrorist is right here. This is a disease that's killing us. So that's what we need to work on. What do you think they should do?
No one is going to fix this problem except that individual. As physicians, we have a responsibility to educate our patients, to tell them why it's important to them, to point out some of their behavioral traits that are maybe not good, but no one's going to fix it except the individual. So you need to be motivated. You don't want to wait until disease has set in. Yes, diet, exercise. I know everyone's heard that. You can only say that so many times, but it's a motivational factor. Your children are watching you. You have your own behavior traits, your children, your friends. You want to be healthy for yourself, but also those around you.
I think what has happened to medicine is that over the years it became so complicated. You're taking care of breast imaging, you're a radiologist, I'm a urologist, and who really takes care of this particular population? It's the primary care doctors.
Absolutely.
And primary care doctors are overwhelmed. They don't have enough time to spend with the patient. The offices are packed and they are moving faster. And the last thing that in their mind is to give a pep talk about somebody. By the way, you're obese, you have to lose weight. And I think one of the ways that we can take care of this is all of us as a medical community should relay that message. And there should be some screening factor. We have mammograms, which we talk a little bit now soon, and also like PSA screening and colonoscopy. Perhaps there should be some screening mechanism to say, look, your health. This is a true story. I saw a patient that came to my office, 57-year-old, really obese. And you see him, you want to be polite about it. He had a lot of cancer. And of course, he's not optimized to go for surgery, even though we do robotic operation. And I had to be it's a very fine line without insulting somebody, but at the same time caring for them and tell them, like, I want you to lose this weight. So I said, we need to optimize you. We need to really get you to a dietitian, lose weight, and it's a whole lifestyle change.
It's a lifestyle change. It's not just one thing. It's not maybe cutting out a little bit of carbs. It is an entire lifestyle change. And it is also careful. In our profession, I see a lot of patients after or while I'm diagnosing cancer. You don't want to say, you have cancer and you're overweight. So you want to get to them before all that sets in, which again goes on the primary care doctor. But as you've mentioned, they're inundated and a lot of patients don't want to hear it.
I think there's also another fundamental problem with our food chain system. I think we're getting a lot of high calories. We're getting some low-cost food. The portions are really ridiculous. And that's also, we're being fed a lot of sugar and salt. So I think you really need to limit the amount of salt and sugar in your diet. And I think that education starts from the parents. I think if you're going to order the entire pie of pizza and you're going to eat it, the children are watching and you're setting up an example. And that's how childhood obesity is really on the rise. Yes. And I think paying attention to what you're putting in your mouth is an investment of your health. Absolutely. What do you think?
I completely agree with you. As I said, your children are watching you. If you are having processed foods and you're eating everything, an entire pie of pizza, then that is what your kids are used to. Your traits, your kids are going to grow up to, and they're going to repeat those behaviors. So you really want to focus on you try and teach them to stay away from drugs and alcohol, but you also want to teach your children how to eat healthily and exercise as well for long-term benefits. And
Nicole, I think this is really hard. I've seen people 280, 300 pounds, and my heart goes to them. It's not an easy job. It's difficult. But I think creating some sort of a support group, people that really care about you and they're not going to criticize you or put you down, that support is really important. Plus the fact that you need to get the experts in the field. And maybe this is not, maybe you need a psychiatrist, emotional eating, whatever the stress factor that's causing it, whatever the depression factor is that may be causing this. All of those, I'm sure you see them in your practice as well, don't you think?
Yes, absolutely. I see it all the time. And once you get to a certain weight, it's very difficult to lose that weight, especially if you're carrying depression or anxiety along with it, which many Americans are. So you need to treat not only the physical problems, but the emotional problems with that. And it's a global thing when it comes to treating a patient. You can't just treat one thing.
So I think what we're both really telling you is that changing your lifestyle, deciding seriously that you're going to lose the weight, your diet portions, getting help from the experts, and support from your family. If all of that really fails, you talk about certain weights would be very difficult. Based on all the research I've done, if your body mass index is over 40, you really may need to go to some sort of a bariatric surgeon. And this is, by the way, the last resort. This is your nuclear solution to really take care of this. Because if you have a 450, 500 pound person, it's hard to tell them go on a treadmill and start running and lose
Yes.
weight. So that's when I think there's a lot of advances in surgery with bariatrics, whether it's lap band, whether it's sleeve. And you know, tell me about some of the studies that you've read that can, you know, surgical and also changes in blood pressure and diabetes.
So the weight loss surgeries have been life-changing for many, many people, especially Americans. And just like any surgery, there are risks with benefits with it. However, if you are finding yourself morbidly obese, a BMI over 40, something has to change. And running on a treadmill and just changing some of your diet may not help. At that point, you are at a severe risk of getting diabetes and really dying early. So going, seeing a surgeon, deciding what's right for you and undergoing the surgery may be the right thing for you, but you also have to be committed to it. You're gonna have to change your lifestyle. You will still have to change diet and exercise. I always am wary for easy fixes for people, and weight loss surgery is not an easy fix. It is a long road afterwards. But ultimately, you are decreasing your risk of a lot of illness, and for you, it may be the right thing, but it's not the right thing for everyone.
And now you guys know exactly why I like her so much. It was a very honest, direct plea to go out there and really do something about it. I just have one more slide to show you guys because I know the audience always want to hear about the herbs. Dr. Samadi is a surgeon. He's not going to talk about herbs. These herbs that we're putting up actually is not going to cure you, but if of your interest, if you want to add some turmeric, I know you talked about capsaicin, Nicole mentioned ginger, garlic, black pepper, and green coffee extract. All of these are really great in reducing your inflammation and really making you healthier. None of these are going to be solution to lose weight, but if you want to add some of these to your diet, is absolutely perfect. We're going to take a minute break, and when we come back, I want to go over some of, because October is Breast Cancer Month and she's a perfect expert in radiology, questions about the types of mammograms, and so we have some questions from the audience from last week to really ask her. We'll be right back. Dr. Nicole Saphier, about the type of mammograms that's out there and who should get what. Nicole, you see the difference between the regular mammogram and 3D mammograms. Explain to the audience exactly who should get what type of mammograms.
I think everyone's heard of 3D mammograms at this point, and 3D mammography is essentially the new standard of care. So 2D mammography is on its way out, 3D is here to stay. And what it is, if you think of a mammogram, it's like an x-ray. Things are on top of each other, there's a lot of overlapping tissue. A 3D is a volumetric measurement of a woman's breast, so we're actually seeing a lot more. And with that means we're seeing more cancers, but we're also more confident. So we're not calling as many people back for these false positive exams.
So less chance of missing cancer.
Yes, absolutely. Less chance of missing, but also more confidence, meaning fewer women are getting that abnormal letter just to come back and say everything's fine.
What age group, if they have any family history and they're watching the program, at what age should they start getting mammograms?
So all women should start at the age of 40 and have it yearly after that. Now, if you have a very significant family risk of breast and ovarian cancer, or you already have a known genetic mutation, or you have a history of lymphoma where you had chest radiation, you're likely going to start earlier. And everyone varies a little bit, but essentially the rule of thumb is if you have a first-degree relative, a mom, a sister, you want to start 10 years before they were diagnosed. So if your mother was diagnosed at the age of 45, you're going to start your mammograms at 35. But it may be mammograms alternating with MRIs. Everyone's different. You have to talk to your doctor.
Okay. Now I have some questions from last week. The last 2 weeks we've dedicated to breast cancer, and I see that you have a perfect color on. So we had a lot of emails. And by the way, if you have any medical questions, Dr. Saphier or myself, you can go to samaditv.com and send your questions now, and we'll be able to answer them after the show, and we'll get back to you. But these are some of the questions that came in, Nicole. Last week, we had Mary from Arizona that said, you know, I'm going for mammogram. Can I wear my deodorant on the day of mammogram? I thought it was I didn't know the answer. So is it a big deal for women to wear their deodorants on that day?
It is a big deal, and I'm from Arizona, so thank you, Mary, for the question. It is a big deal, and let me tell you why. A lot of people don't think it is, so they're like, I'll just sneak a little bit, but I know when you have your deodorant on, and let me tell you, because you have the deodorant in your armpit, and when you have an x-ray of that area, it looks like tiny, tiny white dots in that area. You know what else looks like tiny white dots? Very early cancers called in situ cancers, DCIS.
I see.
So those little calcifications can look just like deodorant. So unfortunately, if I see that, I can assume it's deodorant, but I don't know. So I'll have to have you come back. I may need more imaging, which increases the radiation, and it gives you anxiety because I've said you need to come back. Your
Yeah.
mammogram's abnormal. So just don't wear it.
So that's a very good point. I honestly didn't know the answer. So thank you for clarifying this. We have a local question from the Bronx. People in the Bronx drink a lot of coffee. Can I drink coffee on the day of my mammogram?
So you absolutely can. Coffee, what it does is actually stimulates your breast tissue. It just makes it a little bit more tender. So when you're already going to get a mammogram and you're being compressed, having coffee, you may be a little bit more tender. So if you already know that you have difficulty with the compression, I would hold off on the coffee and have it as soon as you walk out.
So on the day of your mammogram, no deodorant, no coffee. This looks, and then
Doesn't
you
sound
go
like a
over
great
there and
day.
they start like pressing your whole equipment. That doesn't sound so good. We have Joanne from New Jersey that says, "Can I get my mammogram during my period?"
You can. Right when you start your period, your breast tissue tends to be really dense, and it also is more tender. So just on the comfort level, you may want to wait a little bit. But when your breast tissue is more dense, it's a little more difficult to see through. So if you actually wait a week after you start your period, or a week to 10 days, that's the best time. That's the best chance that I'm going to have to find those tiny cancers. So you can come day one of your period. It may be more uncomfortable, but it also may not be the best for detecting cancer.
So unfortunately, we're running out of time. I have so many things to talk to you about breast cancer. In the last minute or so that we have, I want you to look straight to the audience and talk about, how can they reduce the risk of breast cancer and what they need to know, because I want to take advantage of your time.
So Breast Cancer Awareness Month, there's a lot of pink. And let me tell you, pink doesn't save lives. And mammography and screening and early detection, it saves many lives, but it won't save everyone. But what you can do yourself is to decrease your breast cancer risk. And again, the thing that really makes us most at risk is being a woman and getting older, and unfortunately you can't do anything about that. But you can maintain a healthy weight, you can eat healthily, you can exercise, and you can have some lifestyle factors, not taking certain medications, that really will lower your chance of breast cancer.
And I thank you for all of the information that you brought with you today. I think we started by talking about obesity, and I know in your field of breast cancer, obesity also plays a big role, and they are at higher risk because of some of the things that we spoke about. So look all around. You talk about obesity and cancer and screening. They all tie in together. So Nicole, thank you very much for being with us. All of this is going to be posted online, and we're going to make sure that we pass it on to everyone out there. Send and email your questions. We're always here for you every Sunday at 12:30. We have different experts that come in and talk about their field, and we hope to see you soon. There are so many things we can talk about.
Absolutely.
I had a great time. I hope you enjoyed it, and hope to see you soon.
Thank you.
Good to see you, Nicole.
too.
Thank you very much. Thank you again.